Hey, future doctors! Let's talk about acid-base balance, a fundamental concept in medicine. It all starts with hydrogen ions or H+. These tiny ions are like the conductors of the pH orchestra, dictating whether a solution is acidic or basic. The more H+ ions floating around, the more acidic the solution. Fewer H+ ions mean a more basic or alkaline solution. Now, where does pH fit into all of this? pH is simply a way to measure the concentration of these H+ ions. Think of it as a scale. A pH of 7 is neutral, like pure water. Anything below 7 is acidic, and anything above 7 is alkaline. The pH scale is logarithmic, which might sound intimidating, but it just means that each whole number change in pH represents a 10-fold difference in H+ concentration. So a pH of 6 is 10 times more acidic than a pH of 7, and a pH of 5 is 100 times more acidic. Maintaining the delicate balance of these H+ ions through pH is crucial for our bodies to function properly. So how do we figure out a patient's acid-base status? We look at a blood sample, specifically something called an arterial blood gas, or ABG. This test tells us the pH of the blood, but it also gives us crucial information about the levels of carbon dioxide, or CO2, and bicarbonate, HCO3, in the blood. These three components, pH, CO2, and HCO3, are the key players in maintaining acid-base balance. They work together in a delicate equilibrium. If one of these values changes, the others will shift to compensate and try to bring the pH back to the normal range, which is between 7.35 and 7.45. By analyzing the ABG results, we can determine if a patient has an acid-base imbalance. Is the pH too low? That indicates acidosis. Is the pH too high? That's alkalosis. But it doesn't stop there. We need to dig deeper to find out what's causing the imbalance. That's where CO2 and HCO3 come in. Our bodies are constantly producing acids as a byproduct of metabolism. Think about it. We're constantly breaking down food for energy, and that process generates acids. So, how do we not walk around in a perpetually acidic state? Our bodies are smarter than that. We have these amazing buffer systems in place that help to neutralize excess acids and maintain a stable pH. These buffers are like chemical sponges, soaking up extra H+ ions when they're in excess and releasing them when needed. But buffers can only do so much. For long-term regulation, our bodies have two main systems that work tirelessly to maintain pH balance: the respiratory system and the renal system. These two systems are like the dynamic duo of acid-base control. The respiratory system, with its rapid breathing adjustments, provides quick and efficient pH tweaks. Meanwhile, the renal system, with its slower but more powerful filtration and excretion mechanisms, provides long-term pH stability. Let's take a closer look at how each of these systems contributes to this vital balancing act. Take a deep breath in and let it out slowly. Feels good, right? But did you know that your lungs are doing much more than just supplying your body with oxygen? They're also playing a critical role in maintaining your pH balance. Remember CO2, one of the key players in the acid-base game? Well, it turns out that CO2 is acidic. When we breathe, we're not just taking in oxygen, we're also expelling CO2. This expulsion of CO2 is our respiratory system's way of getting rid of excess acid. If the pH of our blood starts to dip too low, becoming too acidic, our body sends out an SOS signal. The brain receives this message and tells the lungs to pick up the pace. We start breathing faster and deeper, expelling more CO2, and effectively increasing the pH back towards the normal range. Conversely, if the pH gets too high, becoming too alkaline, our breathing slows down. This allows CO2 to build up in the blood, lowering the pH back to its happy place. It's like a constant balancing act, with our lungs working tirelessly to keep our pH in check. While the respiratory system is the quick responder in pH regulation, the kidneys are the strategic planners. They work more slowly, but their impact on acid-base balance is powerful and long-lasting. Imagine the kidneys as sophisticated filtration systems, constantly filtering our blood and deciding what to keep and what to discard. One of their crucial tasks is regulating the concentration of bicarbonate, or HCO3, in the blood. Remember, HCO3 is our base, the alkaline counterpart to acidic CO2. When the blood becomes too acidic, the kidneys jump into action. They reabsorb more HCO3 back into the bloodstream, boosting the blood's ability to neutralize those pesky H+ ions. At the same time, they ramp up their excretion of H+ ions in the urine, getting rid of excess acid from the body. On the flip side, if the blood becomes too alkaline, the kidneys chill out a bit. They reabsorb less HCO3 and excrete fewer H+ ions, allowing the blood pH to gently drift back down to the normal range. It's a constant process of fine-tuning, ensuring that our pH stays within that sweet spot for optimal health. We've talked about how our bodies work hard to maintain a stable pH, but sometimes things go wrong. When the delicate balance of acids and bases in the blood is thrown off, it can lead to serious health problems. These imbalances are known as acid-base disturbances. There are 4 main types of acid-base disturbances. 1. Respiratory acidosis. This occurs when the lungs can't remove enough CO2 from the body, leading to a buildup of acid in the blood. 2. Respiratory alkalosis. This happens when the lungs expel too much CO2, causing the blood to become too alkaline. 3. Metabolic acidosis. This type of acidosis is caused by an overproduction of acid or a loss of bicarbonate in the body, unrelated to the respiratory system. 4. Metabolic alkalosis. This occurs when there's an excess of bicarbonate or a loss of acid in the body, again, not caused by respiratory issues. These disturbances can arise from a variety of underlying medical conditions. Identifying the type of disturbance is crucial for determining the appropriate treatment and restoring the body's pH balance. Let's break down the 2 main categories of acid-base imbalances, acidosis and alkalosis. We've touched upon these already, but it's important to understand what they mean for the body. Acidosis occurs when the blood pH falls below 7.35. This means there's an excess of acid in the blood, making it more acidic than it should be. On the other hand, alkalosis occurs when the blood pH rises above 7.45, indicating an excess of base and a less acidic environment than normal. Both acidosis and alkalosis can have significant effects on the body's systems, impacting everything from enzyme activity to electrolyte balance. Symptoms can vary depending on the severity and underlying cause of the imbalance. Recognizing the signs and symptoms of these imbalances is crucial for early detection and intervention. Remember, prompt diagnosis and treatment are key to restoring acid-base balance and preventing potentially life-threatening complications. As we've learned, the respiratory system plays a vital role in regulating pH by controlling CO2 levels. When something disrupts this delicate balance, it can lead to either respiratory acidosis or respiratory alkalosis. Respiratory acidosis occurs when the lungs can't keep up with the demand to remove CO2 from the body. This can happen for a number of reasons, such as impaired lung function. Conditions like chronic obstructive pulmonary disease, COPD, pneumonia, and asthma can obstruct airflow and limit CO2 removal. Suppressed breathing can also be a factor. Drug overdose, head injuries, and certain neurological disorders can suppress the respiratory center in the brain, slowing down breathing and causing CO2 to accumulate. On the other hand, respiratory alkalosis occurs when we breathe out too much CO2, making the blood too alkaline. This can be triggered by hyperventilation. Anxiety, panic attacks, and even pain can cause us to breathe rapidly and deeply, expelling more CO2 than our body is producing. Mechanical ventilation can also play a role. When patients are on ventilators, the settings may sometimes cause them to breathe too fast, leading to a drop in CO2 levels. The good news is that respiratory acid-base imbalances often resolve once the underlying breathing problem is addressed. However, it's essential to identify and treat the root cause promptly to prevent further complications. Unlike their respiratory counterparts, metabolic acidosis and alkalosis arise from imbalances in the body's acids and bases that are not directly related to lung function. Let's explore these in more detail. Metabolic acidosis occurs when the body produces too much acid or loses too much bicarbonate. This can be caused by diabetic ketoacidosis. In uncontrolled diabetes, the body breaks down fat for energy instead of glucose, producing ketones as a byproduct. Ketones are acidic and can build up in the blood, leading to acidosis. Kidney failure is another cause. Healthy kidneys help remove excess acid from the body, but damaged kidneys can't perform this function effectively, resulting in acid accumulation. Severe diarrhea can also lead to metabolic acidosis. Diarrhea can cause a significant loss of bicarbonate from the intestines, disrupting the acid-base balance. Metabolic alkalosis, on the other hand, occurs when there's an excess of bicarbonate or a loss of acid in the body. This can be caused by prolonged vomiting. Vomiting can lead to a loss of stomach acid, which contains hydrochloric acid, HCl. This loss of acid can shift the body's pH towards an alkaline state. Excessive use of diuretics can also be a factor. Certain diuretics can cause the body to lose too much potassium and chloride, which can indirectly lead to a buildup of bicarbonate and alkalosis. Treating metabolic acid-base imbalances often involves addressing the underlying condition. In some cases, medications may be given to help correct the imbalance and restore pH to a normal range. When faced with a patient with metabolic acidosis, there's a valuable tool we use to help pinpoint the culprit, the Anion Gap. But what exactly is this gap, and why is it important? In the simplest terms, the Anion Gap is a calculation based on the concentrations of electrolytes in the blood, mainly sodium, Na+, chloride, Cl, and bicarbonate, HCO3. It helps us differentiate between different types of metabolic acidosis. Here's a simplified way to think about it. High Anion Gap metabolic acidosis is usually caused by the body producing too much acid, like in diabetic ketoacidosis or lactic acidosis. Normal Anion Gap metabolic acidosis is often caused by a loss of bicarbonate, for example, due to severe diarrhea or kidney problems. By calculating the Anion Gap and considering the patient's history and symptoms, we can narrow down the potential causes of metabolic acidosis and guide our diagnostic and treatment strategies. So there you have it, future doctors, a crash course on acid-base balance. Remember, maintaining the delicate balance of acids and bases in the body is crucial for health and well-being. Understanding the mechanisms of pH regulation, recognizing the signs and symptoms of imbalances, and knowing how to interpret key diagnostic tools like the Anion Gap are essential skills for any healthcare professional. Keep those brains sharp, and I'll see you in the next video.